Thank you. And with that, I'm going to turn it over to our local health officer, Dr. Bruce Randolph.
Thank you, Mr. Sweat. Greetings, fellow citizens of Shelby County. I just want to spend a moment to just first encourage you to continue with your efforts to be compliant with the safety measures that we've outlined. We're making progress. There's a downward trend. We have not reached yet all of the criteria for improvement for us to open up some businesses that are closed, but we're headed there. Very crucial time is really the next couple of weeks. We've experienced reopening of schools. We've experienced the playing of sports, particular contact sports, football, and we have the Labor Day weekend approaching. So we'll be monitoring certainly data to see what are the effects of these changes. And our hope is that we'll continue to experience this downward trend in all of the criteria that we have laid out for improvement so that we can open up things even more than what they are. As you may be aware that we issued the Health Directive number 11, was effective August 24th, 2020, and I've received some questions about it. One question has been related to the mask directive that's incorporated in this directive. And if you've noticed that we're pretty much requiring everyone who can to wear a mask or face covering if you're older than age 2. And one of the reasons why we have decided that even children should wear face covering is because recent evidence has shown that even children can transmit the coronavirus at rates just as high as adults. And if we're to return back to school and protect our teachers and staff, we need to have students of all ages as possible to wear face covering. Speaking of schools, there's also, if you notice, in the Health Directive, and Mayor Harris has already addressed this, the requirement for schools to work with the health department to help us identify when a student is our staff or teacher tests positive, so that we can identify those who may be at risk, notify them, and place those who need to be placed in isolation, and those who need to be in quarantine. Similar thing will apply to sports. As you're aware, I may have heard that there have been an incident where a player who participated in the game subsequently, a few days later, tested positive. Well, the health department is involved in that process. We're investigating, and we're seeing who all would have been exposed, and if indeed they are close contacts, will be placed in quarantine for 14 days. There's also some recent information about limited services restaurants. I won't go into great detail about that because of some pending litigation. I would only say that any establishment that becomes a full-service restaurant and meet the criteria of a full-service restaurant, we will honor that and expect them to abide by the safety measures outlined in the health directive for full-service restaurants. With that, I will end and allow time for questions that you may have.